Following the remarks, we will open the teleconference line to questions from the media. Suite aux allocutions, nous répondrons aux questions des médias. Procédons maintenant à la séance médiatique. Let's begin today's briefing. Over to you, Dr. Tan.
Merci beaucoup. So bonjour à toutes et à tous.
Hello,
everyone. Week is National Volunteer Week in Canada, and we're reminded, especially during these difficult times, of how important it is to support each other, to lend a hand when you can, and to know you're not alone when you need help. To date, over 1,139,000 cases of COVID-19, including over 23,700 deaths, have been reported in Canada. Over the past week, an average of over 8,640 new cases were reported daily. During the same time, the number of people experiencing severe and critical illness continued to rise. On average, over 3,970 people with COVID-19 were being treated in our hospitals each day, including 1,200 people being treated in intensive care units, representing a 24% and a 21% increase, respectively, compared to the prior week. An average of 46 deaths were reported daily over the past week, which is 28% higher than the week prior. There are over 70,300 variant of concern cases reported to date across Canada, with the B117 variant accounting for almost 96% of these. To tackle this wave, we need to use all available tools. That means keeping up with individual precautions and public health measures in your area, as well as deploying all safe and effective vaccines in optimal ways. Vaccination is fundamental to ending the pandemic, and we encourage all Canadians to get vaccinated to protect themselves and their communities from illness, hospitalizations, and deaths from COVID-19. This week, we marked the important milestone of over 10 million doses of COVID-19 vaccine having been administered in Canada. We know there is still a way to go, but we continue to gather strength from good news and a focus on the things we're grateful for. The simple note of thanks we recently received from a Canadian reminds us of how far we have come. I received a vaccine this week, and I am amazed that this time last year we were struggling to understand this virus, and now we are vaccinating against it. Canadians across the country have been channeling this kind of positive energy to help others. One example is vaccinehunters.ca. This community group has banded together to supplement COVID-19 vaccination initiatives by aggregating up-to-date information on vaccine availability on their website and social media platforms. They are helping eligible Canadians find vaccination clinics and pharmacies where they can book an appointment. Their website also provides links to other local volunteer organizations, such as Pink Cars, who are helping seniors 70 years or older in the York region with transportation to get to their COVID-19 vaccine appointments. Similarly, vacstat.ca helps Quebecers find the same day or next day COVID-19 vaccine appointments through their website. Another important volunteer effort is dispelling misinformation to support informed and confident decisions on vaccination. Teams of independent scientists, health professionals, and science communicators have come together in collectives such as Science Up First and the Canadian Muslim COVID-19 Task Force to make science more accessible across platforms, cultures, and languages. Though this may not be your turn yet, there are many ways younger adults can pay it forward and help family, friends, and neighbors get vaccinated by working online, over the phone, or in other ways to help others. Working together, we can bring the infection rate down and keep it down until vaccines have rolled out across the Canadian population. This is how we can all build a vaccine bridge that takes us to greater safety and back to the things we have missed so much. Thank you.
Merci. Bonjour à toutes et à tous.
Thank you. Cette semaine est la
Hello,
semaine de
everyone.
l'action bénévole au
This
Canada.
week is
Elle
National
nous
Volunteer
rappelle,
Week in
surtout
Canada,
en ces temps
and we're
difficiles,
reminded,
combien
especially
il
during
est
these difficult
important de
times,
s'entraider,
of
de
how
donner un
important
coup
it
de
is
main
to support
quand
each
nous le
other,
pouvons et de
to
savoir
lend a
que nous
hand when
ne
you
sommes pas
can,
seuls quand nous avons
and to
besoin
know you are
d'aide.
not alone when you need
À ce
help.
jour, plus de 1
To date,
139 000
over
cas de COVID-19, dont
1,139,000
plus de
cases of
23
COVID-19,
700 décès
including over
ont été recensés au Canada.
23,700 deaths have
Au
been
cours
reported in
de la dernière
Canada.
semaine,
Over the
plus de
past
8
week,
640 nouveaux cas en
an
moyenne
average of
ont été
over
signalés chaque jour.
8,640 new cases were
Au cours
reported
de la même
daily.
période, le nombre de cas
During the
graves
same
et critiques
time,
de la
the number
maladie a
of people
continué
experiencing
d'augmenter.
severe and critical illness
En moyenne,
continued to
plus de 3
rise. On
970
average,
personnes
over
atteintes de la COVID-19
3,970 people with
ont été traitées
COVID-19
dans
were
nos
being
hôpitaux
treated in our
chaque jour, dont
hospitals
1
each day,
200 personnes étaient
including
traitées dans des unités de
1,200
soins
people
intensifs,
being treated in
ce qui
intensive care
correspond à
units,
des augmentations de 24
representing a
et de
24%
21
and a 21%
respectivement par
increase,
rapport à la semaine
respectively,
précédente.
compared to the prior
En
week.
moyenne, 46 décès ont été
An
recensés
average of
chaque jour
46
au cours de
deaths
la
were
dernière
reported
semaine,
daily over the
soit
past week,
28 de plus que la
which is
semaine
28%
précédente.
higher than the
Nous
week prior.
enregistrons plus de 70
There
300
are
cas de
over
variants préoccupants à
70,300
ce jour au
variant of
Canada.
concern
Le
cases
variant
reported to date across Canada, with
représentant
the
presque
B117 variant
96
accounting
des
for
cas.
almost
Pour lutter
96% of these
contre cette
cases.
vague, nous devons
To
utiliser
tackle
tous
this
les
wave,
outils
we
à
need to
notre
use
disposition.
all available
Cela
tools.
signifie d'appliquer les précautions individuelles
That
et les
means
mesures de
keeping up
santé
with
publique dans
individual
sa région,
precautions and
ainsi que
public health measures
d'administrer de
in your
manière
area,
optimale
as
tous les
well as
vaccins
deploying
sûrs
all
et
safe and
efficaces.
effective
La
vaccines in
vaccination est
optimal ways.
fondamentale pour arrêter la pandémie
Vaccination
et
is
nous
fundamental
encourageons
to
tous les
ending the
Canadiens
pandemic,
à se
and we
faire
encourage
vacciner
all
pour se
Canadians to get
protéger et
vaccinated to protect
protéger leur
themselves and
communauté
their
contre la
communities
maladie.
from illness,
Les hospitalisations et les décès
hospitalizations,
dus à la
and deaths
COVID-19.
from
Cette
COVID-19.
semaine, nous avons franchi une étape
This
importante.
week, we marked
Plus de
the
10 millions
important
de doses de
milestone
vaccins
of over 10
contre la
million
COVID-19
doses of
ont été
COVID-19
administrés au
vaccine having been
Canada.
administered in
Nous
Canada.
savons que la bataille n'est pas gagnée,
We know
mais nous
there is still a way to
continuons
go,
à nous réjouir
but
des
we
bonnes
continue
nouvelles
to
et à
gather
nous
strength from good news
concentrer sur les choses pour
and
lesquelles
a
nous sommes
focus on the things we're
reconnaissants.
grateful for.
Ce simple mot de remerciement que nous avons
This
reçu
simple note
récemment
of thanks we
d'un
recently
Canadien
received
nous
from a
rappelle
Canadian
tout ce que
reminds
nous
us how
avons
far we have
accompli.
come.
J'ai reçu le vaccin cette
I
semaine
received the
et je ne peux
vaccine
pas
this week,
croire qu'à la même
and
époque
I'm
l'an dernier,
amazed that
nous
this
avions
time
du mal à
last year we
comprendre
were
ce
struggling
virus
to
et
understand this
qu'aujourd'hui,
virus,
nous
and
vaccinons
now
les
we are
gens.
vaccinating against it.
Partout au pays, les Canadiens ont fait
Canadians across
rayonner
the
ce
country
genre
have been
d'énergie
channeling this
positive
kind
pour
of
aider
positive
les
energy to
autres.
help others.
VaccineHunters.ca
One
en
example
est un
is
exemple. Ce groupe communautaire
vaccinehunters.ca.
s'est formé pour
This
compléter
community
les
group has banded
initiatives
together to supplement
de
COVID-19
vaccination contre la COVID-19
vaccination
en
initiatives
rassemblant de l'information actualisée sur la
by
disponibilité des
aggregating
vaccins sur leur
up-to-date
site web
information on
et les
vaccine
plateformes des
availability
médias
on their
sociaux.
website
Ils
and
aident les
social media
Canadiens admissibles à
platforms.
trouver des
They
cliniques
are
de
helping
vaccination
eligible
et des
Canadians
pharmacies
find
où ils
vaccination
peuvent
clinics
prendre
and
rendez-vous.
pharmacies where they can
Leur
book an
site web
appointment.
fournit également des liens
Their
vers d'autres
website also provides links to
organisations
other local
bénévoles
volunteer organizations,
tels que Pink Cars, qui aident les
such as
personnes âgées
Pink
de
Cars,
70 ans ou plus
who
de
are
la
helping
région de New York
seniors
à se
70 years
déplacer
or
pour se
older in the
rendre à
York
leur
region
rendez-vous
with
de
transportation
vaccination
to get to their
contre la
COVID-19
COVID-19.
vaccination
De même,
appointments.
le site web vacstat.ca
Similarly,
aide les Québécois à obtenir un rendez-vous le
vacstat.ca
même jour
helps
ou le
Quebecers
lendemain
find
pour se faire
same-day or
vacciner
next
contre la
day
COVID-19.
COVID-19
Un
vaccine
autre
appointments
effort
through their
bénévole
website.
important consiste à
Another
dissiper la
important volunteer
mésinformation
effort is
pour que les gens
dispelling
puissent prendre des
misinformation to
décisions
support
éclairées en
informed and
toute confiance
confident
en
decisions
matière
on
de
vaccination.
vaccination. Des équipes de scientifiques indépendants,
Teams of
de
independent
professionnels de la
scientists,
santé et
health
des communicateurs
professionals, and
scientifiques
science
se sont
communicators have
regroupés
come
pour
together in
former des collectifs
collectives
tels que la
such
Science
as
d'abord et le groupe de travail
Science Up First
canado-musulman contre la
and the
COVID-19,
Canadian
afin de
Muslim
rendre la science
COVID-19
plus
Task Force
accessible,
to make science more
quelles que soient
accessible
les plateformes, les
across
cultures et
platforms,
des langues.
cultures, and
Votre tour
languages.
n'est peut-être pas encore arrivé,
Though it
mais
may
sachez
not
que
be
les
your
jeunes
turn
adultes
yet,
peuvent de diverses
there are many
façons
ways
poser une
younger
geste
adults can
concrète
pay
et
it
aider leurs
forward
familles,
and help
leurs amis
family,
et leurs voisins
friends,
à se
and
faire
neighbors
vacciner
get
en
vaccinated
travaillant en
by
ligne,
working
par téléphone
online,
ou par d'autres
over
moyens
the
pour aider
phone,
les autres.
or in other
En
ways to help
travaillant
others.
ensemble, nous pouvons abaisser le
Working
taux
together,
d'infection et le
we can
maintenir
bring the
bas
infection rate
jusqu'à
down
que la campagne de
and keep
vaccination
it down
ait
until
été menée dans
vaccines
toute la
have rolled
population
out
canadienne.
across the entire Canadian
C'est ainsi que nous
population.
pourrons tous contribuer à
This is
atteindre
how we can
l'immunité
all all
que nous
build the
permettre
vaccines bridge.
en sécurité
that
et de
takes us to
profiter à
greater
nouveau des
safety
choses qui nous
and
ont
back to the
tant
things we
manqué.
have missed so
Merci.
much. Thank you.
Thank you, doctors. We will now open the phone line to questions. Please identify yourself and include the media outlet that you are representing. We'll be taking your questions in both official languages, and we ask that you limit yourself to one question and only one follow-up. Comme d'habitude, veuillez vous nommer et nous dire quels médias vous représentez. Nous vous demandons de vous limiter à une question et seulement une question de suivi, et vous pouvez poser vos questions dans l'une des deux langues officielles. Donc, commençons la période de questions. Over to you, Mathieu.
Merci, thank you. Please
Thank you.
press star 1 at this time to ask a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question, la première question est de Philippe Vincent Foisy de Radio-Canada. La
The
parole
first
est à vous.
question is from Radio-Canada. Please go ahead.
Oui, bonjour.
Question.
Une question en français
Yes,
sur
I
les
have a question in
recommandations
French
de
as
NACI,
to
donc du Comité
the
consultatif
NACI
canadien sur
recommendations, the National
l'immunisation.
Advisory
Hier,
Council
on
on
était censé avoir
Immunization.
une conférence de presse sur
There's supposed to
AstraZeneca. Elle a
be
été
a press
annulée.
conference. There was supposed to be a
Pourquoi elle
press
a été
conference, but it
annulée?
was cancelled. Why was
Pensez-vous
the
pas que ça
NACI
ajoute un
press
peu des
conference
craintes par
cancelled?
rapport à la
Don't you
confiance
think
que
that
les
will
gens
only
ont envers
add
ce
to people's
vaccin-là?
fears and lack of
Donc, juste
confidence
essayer de nous
about
expliquer ce qui s'est passé, pourquoi on a
some
décidé de
vaccines?
retarder
Can you please let us know
les
why they decided to
recommandations.
delay the
Puis,
recommendations?
qu'est-ce que vous pensez du fait qu'on les donne aux
And what
40
do you
ans, aux
think about
45
the
ans et
fact
plus?
that it's now being, the AstraZeneca is now being given to
Oui,
ages 40 and
merci
up?
pour la question. C'est Dr. New.
Answer. Thank you for the question.
Oui,
This
c'est
is Dr.
toujours
New.
quelque chose qui
Yes,
est recommandé,
it's
un
always
enjeu
something
actuel. Qu'est-ce qui se passait, je
that is
comprends.
a current challenge.
C'est le Comité consultatif national de l'immunisation, le CCNI en français, qui est en
NACI,
train
the
de
National Advisory
recevoir
Council on
et aussi
Immunization,
analyser
is receiving and
comme des données
analyzing
probantes qui se sont soumises à jour. C'est
all
toujours
the
un défi
updated
parce que
evidence,
si on
which is always a
attend
challenge
toujours
because
des autres données probantes avec
if
l'expérience
we keep waiting for
à travers le monde,
all
mais
the
aussi
data
au
and studies
Canada,
being
on peut
done
être
across the
critiqué
world and
pour
here in
être trop
Canada,
tard,
then we're
mais si
criticized for being
on
too slow.
déclare
But
peut-être trop vite
if
et
we make
peut-être
a
le
decision
lendemain,
too
il
precipitously
arrive
and
encore
then the
d'autres
next
données
day
probantes, on est aussi
some further
critiqué de
data
l'autre façon.
surfaces,
Donc,
we may be
ce que je
criticized for
comprends,
acting too
ils sont
quickly.
en train
So
d'analyser
I
des données
understand that
probantes
they are
importantes. Je
currently
pense même
analyzing
ici
very important data,
qui arrive qu'est-ce qui est disponible ici au Canada. Je pense
and
concernant aussi
including the
les
data that's
bénéfices et
available here in
avantages,
Canada,
ça va
and weighing the benefits and risks.
ça va donner des autres considérations peut-être pour ajuster leurs recommandations.
And
Mais je
so they
pense
may be
en fin de
considering
compte, je
adjusting
pense
the
que
recommendations further.
ce
So,
que le
but in the
comité
end,
est toujours sensibilisé à faire cette données de
this
recommandations
committee continues
avec,
to
avec
be sensitive to
leur
providing
expertise
recommendations with
pour
their
les
own
provinces et
expertise,
territoires à
based on their own
considérer pour
expertise
leur
for
propre programme
provinces and
de
territories to
vaccination. Parce que c'est en
consider
fin
in
de compte, c'est
determining
vraiment
their
les
own
provinces et
vaccination
territoires
programs,
qui
because
sont
really,
responsables.
ultimately,
Et
the
je pense
provinces
que
and territories are responsible for
les
the vaccine
changements
rollout. And
maintenant même les quelques provinces ont déjà fait
a few
des
provinces have
modifications, des
already
changements.
made some
C'est aussi parce
changes,
qu'on
and
a
that is
eu une
because
réunion, même une téléconférence
we had a
la fin de
meeting.
semaine
We had a
précédente
teleconference
avec
last
le comité
weekend
et
with the
on a
committee,
discuté aussi les
and we
dernières
did
données probantes
discuss the
disponibles. Donc,
latest available
les
data
provinces et territoires ont déjà
and
commencé
evidence,
à
and
adapter
certain
leur
provinces and
programme de
territories have
vaccination.
already begun
Et
to
maintenant,
adapt
le
their
comité
vaccination
est en
programs
train
as a
d'analyser
consequence.
d'autres
And now the committee
données probantes. Et je
continues
pense que
to analyze even more
bientôt,
recent data.
ils
So
vont,
I believe
comme
that
dire,
soon
faire une autre déclaration
they will be
peut-être avec
making
une mise à
another
jour
statement with
de leurs
with
recommandations.
possibly another
Et je pense
update,
que
more
la question
updated
pour
recommendations. I
confiance,
believe
j'espère que
that
ça
people
va
should
donner
feel
aussi
confident,
un niveau de confiance pour
and I think that
toute
this
la
will help
population
bolster
canadienne parce
the
que ça
entire
indique que
Canadian population's
le comité
confidence in this
prend
vaccine.
au sérieux le travail et
We
est
can
toujours
see
en
how
train
seriously the
d'analyser,
committee
de
takes its
recevoir
work
les données
and is
probantes
constantly
pour
analyzing
ajuster avec la
updated
science qui
data and
continue
evidence
à
and
évoluer.
adjusting its
Merci.
recommendations as the science evolves.
Merci,
Thank you.
Dr.
Teresa Tamia, could I
Can you just repeat that in English, please? Yes, go ahead, Dr. Tan.
Yes, I was going to
Okay.
just repeat that in English because I think everybody seems to have an interest on this question, which is about the National Advisory Committee on Immunization and why they didn't do their technical briefing yesterday. So, as Dr. New had indicated, the committee, the National Advisory Committee on Immunization, was about to release their latest recommendations, an update to the recommendations for the use of AstraZeneca vaccine in light of the rare reports of a serious blood clotting and low platelets disorder. And just to assure everyone that it is because they received some new data they thought was pertinent in terms of analyzing the impact of the COVID-19 on the population in light of variants of concern, and not because of any changes in the data already existing for the thrombosis disorder itself. That remains a rare disorder, and the rates that they were looking at hasn't changed. It's more when you're balancing the benefit and risk analysis, it's important to look at the benefit of the vaccinating individuals given the increase in the epidemic activity in many parts of the country. And so that is what they're working on, just to validate the information that they had before with the new data. But as Dr. New said, the data is always undergoing evolution. So they're going to take this final look, and then they'll be out with the update shortly. We did have a meeting with all the chief medical officers and the National Advisory Committee on Immunization over the weekend. So they do have the analysis at hand as they were making their decisions that you have seen announced over the last few days.
Thank you, Dr. PV. Question suivie?
Oui,
Do you have a follow-up question?
On voit qu'il y a des vols en provenance du Brésil encore qui sont acceptés
We
au
see
Canada.
that
On voit qu'il y a
certain
des vols en
flights coming in from
provenance
Brazil are still
d'Inde
being
aussi qui
accepted in
viennent du
Canada, as
Canada.
well as
À
from
quel point la
India.
santé publique se préoccupe
what
de
point
voir qu'il y a des gens qui peuvent encore
Will
rentrer au
Health
pays
Canada be
avec
concerned
des
by the fact that
variants
people can continue to
venant
enter
de
the country
pays où la
carrying
situation
variants
n'est
from
pas du tout
countries
sous
in which
contrôle? À quel point
the
ça, c'est
situation is not
préoccupant?
at all under
Surtout
control?
quand on se souvient du rapport
How
du
far,
vérificateur général qui
how
disait
much is
qu'il
this of
y a une
concern?
grande partie où le suivi n'est pas fait. Donc, est-ce que la santé
It seems
publique est
too that the
inquiète
follow-up
de voir
measures
qu'il y a
are
encore
not
des vols en
properly
provenance de
implemented.
pays
So is
où
Health
les
Canada
variants très
concerned by the
dangereux
fact that
sont
we're still
prédominants?
seeing flights coming in from countries in which variants of concern
C'est
come?
Dr. New, peut-être moi je peux commencer.
Answer. This is Dr.
Oui,
New. Perhaps I can
c'est
begin to
toujours quelque
answer.
chose qui c'est une préoccupation.
Well,
On surveille
it's
toujours qu'est-ce
always
qui se
a
passe à
concern
travers le
that
monde et
we keep
aussi
an eye on
qu'est-ce
we're
qu'on fait
keeping an eye on
avec
what's
nos
going on across
frontières
the whole
parce que
world and
la
deciding what we do
sécurité,
about our borders.
pour protéger la santé des Canadiens, c'est
Because
toujours
protecting
priorité.
Canadians'
Donc,
health
je
is
pense
always our priority.
qu'avec les
I
mesures
think
qui sont déjà en
that
vigueur
with the
à nos
measures
frontières, en
currently in
mettant,
place
on
at our
exige
borders,
tous les
we are
voyageurs qui arrivent au
currently
Canada
requiring
d'avoir
that any visitor arriving in
un test
Canada
d'épisage avant leur
have
arrivée ici
undergo
au
a
Canada, puis
test
un autre
before they arrive in Canada,
test
and then take
d'épistage
another test
avec l'arrivée, et puis un
once
autre
they arrive in Canada,
10 jours
and
après
another one 10 days later,
pour assurer qu'ils ne sont pas
to
contaminés
ensure
avec une
that they
infection.
are not
C'est sûr,
infected.
c'est aussi avec une quarantaine obligatoire de
And of
14
course,
jours.
there is
Donc,
the 14-day
avec ça,
mandatory
je
quarantine
pense
period.
qu'au
So I think
complet,
with all of
je
those
pense que c'est
measures
vraiment des mesures
taken together,
parmi les plus exigeantes
they
partout dans
are
le monde.
amongst the most
Mais à part
rigorous
de ça,
measures
oui, on
and
sait,
requirements in the world.
et toujours qu'est-ce qui se passe avec comme l'émergence des
But of
variants
course,
partout dans
we're
le monde.
always watching
Vous
what's
avez
going on with
constaté
the
peut-être que
emergence
c'est
of
Brésil
these new
maintenant, peut-être
variants.
l'Inde, mais peut-être un autre pays
mentioned
plus
Brazil
tard.
and
Donc,
India, and there may
je
be
pense
other countries
que c'est toujours
further
important
down
de
the
voir
road. I
aussi,
think
comme
it's
on dit,
always important
une approche globale,
to
pas
maintain
toujours,
a
comme il
global
dit,
approach.
viser sur les pays, après, comme il dit, identifier une variante, parce
And once
qu'en effet,
new
c'est
variants
trop
are
tard. C'est
identified,
comme chasser la queue.
of
On dit
course,
souvent en français, ça traduit
it's
bien,
like
mais
chasing your own
je
tail.
pense
The
qu'on est
virus
toujours aussi
continues to
ouvert,
mutate, but
toujours
we're
à
always
examiner
open
qu'est-ce qu'on fait à nos frontières et
looking at
on peut toujours ajuster
the
avec les données
measures
probantes
taken at our
et
borders,
avec l'analyse
and we
et
continue to
l'expérience des autres
analyze
pays.
and
Mais par
collect
contre, je
data
pense
and
que c'est
evidence
important de
from here
constater
and
aussi,
from other
c'est pas
countries.
seulement une question
But I
des
think it's
variants
important
à
to
nos
understand
frontières,
that it's
qu'est-ce qui
not
se passe
just
dans
about
les
the
autres pays,
variants
parce
at our
qu'on
own
sait
borders
avec
and
les
what's going on
virus,
in other countries,
c'est
because
presque
we know
impossible, on peut
that with
pas
viruses, it's
empêcher
practically impossible
comme c'est l'entrée des variants ici au
to
Canada.
prevent new variants from
Regarde
arriving
qu'est-ce
here
qui
in
se passait avec
look what's going on
le variant identifié au
with the
Royaume-Uni.
variant
Je pense que
identified
c'est
in the
très
United
important aussi
Kingdom.
qu'est-ce
It's
qu'on
very
fait au sein
important
du pays
to figure
après
out what it is we're
avec
doing inside our country
l'émergence des variants. C'est très
with
important
once these new
faire le
variants have
suivi des
emerged here.
contacts, toutes les
It's
bonnes
very
mesures de
important to do
santé publique. Il faut
contact
souligner
tracing
beaucoup de
and
choses
lots of
il faut
testing.
faire ici
There are many things that we
aussi,
must continue to
comme
do
dit,
here in Canada.
dans le pays, à part de seulement garder et viser sur qu'est-ce qu'on
Besides
fait
just
avec nos
focusing on what's
frontières.
going on at the border.
Merci.
Thank you.
Merci, Dr. New. We'll take
Thank
the
you,
next
Dr. New.
question.
So maybe, sorry, it's Teresa Tam. I'll just repeat that in English because I think there'll be another question, there'll be a similar question coming up about the border measures and what we're detecting and what might be some of the concerns. So, of course, the virus globally is undergoing evolution, and there are many different mutations and changes in the virus, particularly in countries that have a lot of cases. Of course, that gives the virus more chance to do that mutation. There's been several that's been identified as variants of concerns that you've all heard about, the B117, B1351, and the P1, which was originating from Brazil. So given that situation, the strategy for Canada was to add more layers of protection for every country. So the pre-boarding test, the post-arrival 2 tests, and of course our foundation, which is a 14-day quarantine, trying to add more reinforcements, the government authorized accommodation to await that first test, and just engaging more people on the ground, ensure compliance, were all put together at the time when the UK first notified of a variant of concern. There are many variants which are under monitoring, which we call variants of interest, which includes the variant that has been reported from India. We don't understand enough about it, but there are mutations on it that are similar to other variants of concern, which means that, of course, we need to look at that data very carefully, but there's not a lot of information that's coming out of India at the moment. But so these are universal measures that we've been layering upon at the border. The testing has been very helpful. So we've been detecting test positive travelers, as well as sequencing every one of them to look at what variants might be coming across the border, and that will help inform us of what further needs to be done. For Brazil, there are low numbers of travelers. The P1 variant has been picked up through border screening, but not just from Brazil though, because we know that it's actually in 50 probably now, somewhere between 40 and 50 other countries. So country-specific targeted measures can only go so far. It's actually the broader application of measures to all countries that Canada has been focused on. India, we will be doing further analysis because it's an emerging situation, not just because of the variant of interest at this point, but because they have unfortunately, a very massive resurgence in that country, and we'll be doing that risk assessment again and using the data that we have now collected at the border to inform our next steps. Thank you.
Thank you, doctors. Now we'll go to the next question, opérateur.
Merci. The next question is from Annie Bergeron-Oliver of CTV National News. Please go ahead.
Hi, thank you for taking my question. Nearly 1 million people in Canada now have nearly 1 million Canadians have now been fully vaccinated, and many of those are high-risk seniors living in congregate care. The CDC eased public health restrictions for fully vaccinated people weeks ago. Why hasn't Canada changed the rules, especially when it comes to seniors who are essentially still locked up in their long-term care homes?
So yes, we've had 10 million close to 10,500,000 individuals vaccinated at least with the first dose. And we do know that some of the long-term care facility residents are now receiving their second dose. So that's great news. The other great news, of course, is seeing in the seniors coming down and the number of long-term care facility outbreaks coming down. And even the ones having outbreaks, there are fewer cases. So that vaccine effectiveness is being monitored in key jurisdictions with researchers and demonstrating the effectiveness of that initial dose, but coming back with that second dose. So I think that's important. And to change policy, I do think that the long-term care facilities are the one area where you will see that policy shift beginning, so that there will be more ability for seniors in those homes to return back to some of the normalities and having more visitors, although the visitors, of course, may not be vaccinated at this point in time. But all of the precautions still has to be taken. But provinces are in charge of those policies, and you will begin to see them using the data at hand and what they're seeing on the ground in order to adjust those policies. But of course, outside the doors of the long-term care facilities, we have a ways to go. Some of the senior age groups haven't completed the vaccination, although those seem to be going well. And healthcare workers, we want to make sure they're all provided with a vaccine. I think the uptake's quite really good too in healthcare workers, close to 90% with at least one dose. But just a reminder that, of course, Canada's strategy is getting one dose to everyone as fast as possible on all the eligible age groups and coming back with that second dose. We are taking a community-based approach where individuals are protecting themselves with that very effective first dose, but also to generate the community level of I protect you, you protect me kind of concept in direct protection, so that everyone can benefit from increased social and connections as a result of that community-based, population health-based approach. But I do think that, of course, we'll all begin to adjust those measures. But if you look at the United Kingdom being the country closest to us with their strategy of the one dose with stretch interval, they are being very careful. You need to drive down that epidemic. So this third wave needs to come under control, and then we need to be able to ease those measures very slowly while the vaccine coverage is increasing.
Okay, well, that leads into my next question. My follow-up is that a chart in the budget suggests about 80% of Canadians will have at least one dose by Canada Day, with the economy projected to pick up drastically starting very shortly after. Will a strong majority of Canadians only getting one shot be enough to ease restrictions across the country?
So what eases restrictions across the country is getting the epidemic under control, the pandemic in Canada under control. That has always been the driver of easing measures. Do not ease measures rapidly on the way down. Like this is what happened in that second wave. You ease, partially down the epidemic curve, the virus will come back very quickly. With vaccines on board, the chances of that may be diminished, but it's not, completely eliminated. And so getting that second dose is very important to ensure that when we relax measures, you're not back to sort of the beginning of trying to get the virus under control. It has to be both public health measures and the vaccine right now to plank the curve again. That's what's going to let us have more relaxation in those restrictive public health measures. So, of course, we want to track this as we go along, but vaccines gives us a much better chance of being able to do that. So that's why it's very important to get vaccinated.
Yeah, it's Dr. You just said to underline what Dr. Tam said. I think we've said it several times, myself included, that we should be following the data and not just dates. So vaccination, certainly vaccines are a very important tool, very key in terms of, as you say, trying to get towards a sort of a future where we might be relaxing some restrictions, but certainly the public health measures are key. Certainly, look what's happening now in Ontario. It's not going to be vaccines alone that solve the current situation in Ontario. You need to be very strict with the public health measures. And I would say that's also twofold. I think at an individual level, people really have to think about what activities they're undertaking. Are they really just the essential activities, going out for groceries and so on? Or, are there still some discretionary activities that they really should not be doing, like, traveling for a vacation or going for a recreational sort of a pleasure activities, even outside of their own community. So that's something to consider. And then, of course, at the population level with governments and so on, it's a type of restrictions that really try to decrease mobility and decrease the types of interactions, the number of interactions people have. And I think to support, what was put forward by the Science Advisory Table in Ontario, it's not just a matter of saying people, decrease your contacts. There are many people, the essential workers, that are not able to, for lots of reasons we all know about, in terms of, lack of sick days, other social supports, and so on. So I think to get to that point, it's very important to have those supports as well, so that all Canadians can hopefully, in a sense, feel protected and have the measures in place that they can also practice personally, and also at a population level of the public health measures as we keep rolling out the vaccines. Thank you.
Thank you, doctors. We will move to the next question. Prochaine question, opérateur.
Merci. La prochaine question est de Raymond Filion de
Next
TVA.
question,
La parole est à vous.
TVA. Please go ahead.
Merci beaucoup. Dr.
Thank
Liu, juste
you.
pour revenir
Dr.
à l'Inde
Liu,
et
just
ses
to come
variants,
back
est-ce que suspendre les
India and
vols,
its
comme ça a été le
variants.
cas cet hiver pour le Royaume-Uni,
If we
pourquoi c'est pas un
suspend
scénario qui est
flights,
envisagé à l'heure actuelle?
why
Vous pouvez
are we
juste
considering
expliquer
suspending
ça
flights from
brièvement.
India as we did for in the spring or last year
Okay,
for
brièvement, je
United
pense
Kingdom
que,
when
comme
its
je
variants
pense même le
emerged?
Premier ministre
Answer,
a
just briefly,
constaté,
even the Prime
on
Minister
examine, il y a toujours toutes les
has
options
stated
sur
that
la table.
all
Donc, je
options
pense
remain on the table.
qu'il faut
I
faire une
think
analyse parce
that
qu'on
we do
a
have to
maintenant
perform a
aussi,
proper analysis.
comme on dit, l'expérience avec qu'est-ce qui se passait
We
avec,
now
comme
have
vous avez constaté,
experience
l'expérience avec le
with
Royaume-Uni.
what happened with the
Après ça,
UK
on a mis
variants, as you
des autres
said.
mesures
So
en
after
vigueur
that,
à nos
we
frontières avec le
implemented further
dépistage
measures
avant
at
l'arrivée
the
des
border
voyageurs
with
ici au Canada,
pre-testing,
puis aussi des
pre-arrival
dépistages,
testing,
aussi la
and
quarantaine
arrival testing,
de
as well
14
as the
obligatoire. Donc,
14-day
il
mandatory
faut
quarantine
examiner les
period.
mesures
So
qui
we
sont
have to
déjà
look at
en
measures
place
that are
maintenant.
already in place
C'est quoi
today,
l'efficacité des
see
mesures?
how
Est-ce qu'on
effective
peut faire
those
des
measures
autres
are,
ajustements?
see if they need to be
Comme
adjusted.
Dr. Tam et moi,
And as
aussi,
Dr.
on a
Tam
constaté,
and I have
c'est difficile
stated,
toujours comment dire, de viser un pays à la fois. Je pense que c'est peut-être plus important, plus efficace, peut-être
it may be
avoir une
more
approche, comme dit,
effective
globale
to
pour
adopt a
assurer la
global
sécurité à nos
approach rather than focusing on one
frontières,
country at a
comme si
time
c'est possible. Mais oui, aussi, au
ensuring
fur et à
safe
mesure,
borders.
s'il y a quelque chose, on peut faire
But if there are
comme
other
dire,
measures, we
rapidement
can
pour gérer une
implement
situation,
quickly
par
to
exemple,
manage
pour
a
l'Inde. Je pense
situation, for
qu'on est
example, the
toujours ouvert
situation
et
in India.
on est en
We're
train
always
d'avoir des
open to that
discussions et aussi
possibility,
une
and our
évaluation, une
conversations,
analyse
our
des
discussions
risques à
continue,
l'heure
as
actuelle.
do our analyses of current risks.
En suivi, à quel point,
As a
selon
follow-up
vous,
question,
c'est impératif à
in
l'heure
your
actuelle de
opinion,
réduire ou d'éviter
how
complètement
important
les
it is
déplacements entre une région à l'autre du Canada, entre les provinces,
to
surtout avec les
prohibit
variants?
movements between various regions in Canada or
Oui,
provinces,
je pense
especially given the
que
new
c'est un
variants?
enjeu actuel.
Well, I
Je
think
pense
that is a
avec
current
toutes les
issue,
provinces et territoires, je pense même en
along with provinces
Colombie-Britannique,
and territories, even in British
on
Columbia,
a
I
déjà
believe.
conseillé, encouragé, je ne sais pas c'est quoi,
We have
tout le
advised
vocabulaire
or
des mots des
encouraged
Canadiens de pas
Canadians,
se
or they have
déplacer, vraiment
encouraged
rester chez
Canadians
vous,
to stay at home,
rester dans votre région.
to
Oui, c'est
remain in
toujours
their own
important
region.
peut-être sortir, prendre l'air fraîche,
Of course, it's always
mais
important to go
sûrement dans
outside and
votre
get some fresh
communauté, pas
air,
vraiment
but
se déplacer, même
to really to stay in your own
dans
community, not
votre
even to
région. Je
move
pense
around
que,
inside
par
your region.
exemple, en
For example,
Colombie-Britannique, si on
British
est à
Columbia,
Vancouver,
if you're in Vancouver,
on décourage les gens de même aller à
residents
Whistler,
of
même si
Vancouver
c'est
are
dans la
being
même
discouraged to
région,
go
on
to
peut dire,
Whistler, even though
de la
one could say
Colombie-Britannique.
that
Je
it's
pense
in
que
the
c'est le
same
même
region
principe
or the
partout
same area, and
dans
I
les
think the
pays
same
et
principle
aussi
applies across the
on
country.
décourage les gens
People
de se
are
déplacer
being
entre les
discouraged
provinces.
from
je pense que c'était mangé
traveling
avant
between
que
provinces.
même on a vu beaucoup des Canadiens
As we saw,
sont
many
allés
Canadians
peut-être dans les autres provinces pour les
traveled to
loisirs,
other
des vacances de
provinces
ski. Et maintenant,
to
c'est
go
hey,
ski
avec
and
les variants,
have other
c'est
types of holidays. And
vraiment
now we're saying, look, with
important.
these new
On voit qu'est-ce
variants,
qui se
it's
passe
really
actuellement
important. We can
en
see what's
Ontario.
going
C'est
on
une
now in
crise.
Ontario.
Une
It's
crise
a
de
real
santé
crisis.
publique, une
It's
crise
a
avec
public
le
health
système de soins de
crisis
santé. Je
and
pense
a healthcare
qu'il faut
crisis.
vraiment, comment dire, tirer des leçons avec
We
qu'est-ce qui se
really
passe
need to learn
actuellement en
from what's
Ontario
happened and
et
what's
c'est
going on right
vraiment pour
now
tout
in
le monde,
Ontario.
restez chez vous. C'est simple.
People just need to stay at home. It's quite simple.
Merci, Dr. New.
Thank you,
Our
Dr.
next
New.
question.
Thank you. Merci. The next question is from Evan Dyer of CBC News. Your line is open. Please go ahead.
Hello, thanks for taking my question. I'd like to ask, you mentioned that you're currently doing a risk analysis on the situation in India. Do you know when that might be ready?
I can't comment on that. We are always looking at the data, including who is testing positive coming into Canada, for example, and we have to get as much information as possible, for example, on that variant of interest, and which is not yet a variant of concern. So lots of work is being done in multiple departments to look at that situation. But as I said, that it can be one country one day, another day. So it is very important that we have been taking these more broad measures for any traveler.
And just to follow up on that, I know that India and Brazil both have variants, but are very different countries in a way. I mean, India's been a kind of a model citizen, sharing vaccines with other countries. Brazil, I think, has been widely seen as a very irresponsible government, not taking COVID seriously. You were talking about the idea of, I protect you, you protect me, and we do penalize individuals who don't take COVID seriously in Canada. Do you think that as this pandemic develops and as we start to emerge from it, there will be a place for pressure or action against countries that don't appear to be taking COVID seriously, continue to spin off variants that threaten other countries' vaccination campaigns?
Well, I think, internationally, in many ways, we are in it together. And as long as countries are not able to control what's happening domestically, it will affect everyone else. But we have to control what we can control, which is the measures that we've sort of put in place. The many layers, we kind of kept adding some more, but the testing regime, I think, is really important so that we can manage the individuals coming into Canada and reduce the risk of the variants of concern. I mean, I think if you look back at the statistics, the number of travelers have already been significantly reduced compared to, of course, pre-pandemic times. But these layers of measures are meant to help us reduce that spread. No border measures are completely 100% effective, of course. Every layer adds another layer of protection. I do think that it is important, wherever we can, to assist others so that it has a benefit at the other end for Canadians and people who are in this country as well. So I think it takes so many layers of discourse and arrangement, some of which is not really in the agency's area of influence. But I think the whole of government and our ministers are, of course, looking at that in terms of other countries. Anyways, I think maybe I'll leave it at that. Thank you. But Brazil and India are actually very different on many other fronts. There are many more connections with India to Canada than there is to Brazil for all sorts of reasons, and many different types of travelers and many Canadians who are in India, and there's traffic from that perspective as well. So there's many considerations before any other actions are taken.
Thank you. Operator, next question. Prochaine question.
Merci. La prochaine question est de Boris Proulx du Devoir.
Next
Votre ligne
question
est
from
ouverte. À
Le
vous la parole.
Devoir. Please go ahead.
Bonjour, j'aimerais rebondir sur
Hello, I'd like to
la
come
question
back
plutôt concernant
to
le
an earlier
Comité
question
national sur l'immunisation.
about the National
J'aimerais savoir si vous
Advisory
pouvez me
Council on
résumer
Immunizations,
quels sont
Nancy.
ces
Could
travaux
you
en ce moment parce
summarize
que
what they're working
on veut
on
savoir ce qui se
currently?
passe. On
We
comprend
would
que
like
10
to
minutes
know what's
avant la
going on.
conférence de presse hier,
We
ils
understand
l'ont
that
annulé parce qu'ils ont
they were
reçu
planning
de
a press
nouvelles
conference yesterday,
informations.
but they
Que
then
vous dites,
canceled it because they
juste au
received
moment où
new
les provinces
information.
abaissent
Just
l'âge
when
du AstraZeneca à 40 ans. Donc,
provinces
pouvez-vous me
have
dire
dropped
exactement
the
qu'est-ce qu'on étudie de ce
eligibility
côté?
age to 40. Can you tell us anything more about
C'est
that?
Dr. New, peut-être moi je peux
This is
commencer.
Dr. New.
Oui,
Perhaps I can begin
si
to
je
answer.
peux peut-être préciser qu'est-ce qui se passait pendant
Yes,
la semaine.
I can tell you
On
what's
a eu
gone
une
on this week.
téléconférence
We
avec le
had a
Comité consultatif
teleconference with
national
the
d'immunisation,
National Advisory
CCNI,
Council on
avec aussi
Immunizations,
le
NACI,
Comité
and
consultatif spécial, tous les
also with the
médecins
Special
hygiénistes des
Advisory
provinces et
Committee
territoires.
of
Et
Chief
je pense que c'est
Public
basé
Health Officers of the
sur la
provinces and
discussion, les
territories.
données
And
probantes,
based
la
on those
présentation de
discussions and the
CCNI,
evidence and
je pense
data
la fin de
made
semaine
by NACI
précédente, que
the
les
previous
provinces
weekend, that
et
provinces
territoires
and territories
ont annoncé les
announced
modifications, les ajustements dans leur propre programme de
the new
vaccination
guidelines
pendant la
for
semaine.
eligibility
Et
for this
maintenant,
vaccine over the last week.
le CCNI est
Now,
en train de
NACI
recevoir
is
d'autres données
receiving
probantes. Je pense
further
que
data
c'est
and
pas mal
evidence that it's
changé. Ce que je
analyzing.
comprends, c'est
I
vraiment
don't
sûrement pour
think
être
anything's
plus à
changed
jour
much. It's
avec,
just that
je pense
they always
peut-être
want to keep up to date,
les avantages, regarder vraiment
look at all of the
l'échelle de la
benefits
population,
for the whole of the
avec
of our population,
en considération aussi avec l'épidémiologie
taking
régionale, tout ça. Il y
epidemiology
a beaucoup
into
de
consideration
facteurs, mais je
per
pense,
region, for
en
example.
fin
There
de
are many
compte,
factors to consider.
bientôt, on attend impatiemment la présentation,
And of
déclaration,
course,
peut-être un
we
peu ajustée
impatiently,
avec,
all
en
impatiently await any
considérant
further
les
statements,
nouvelles
updates, or
données
presentations
probantes.
by the
Mais je
Advisory
pense que
Council
pour les provinces et territoires,
following their
c'est
analysis
pas
of new
vraiment
evidence and
un
data.
grand changement parce qu'ils ont
I don't
déjà
think that the
reçu,
provinces and
comme
territories'
dit,
recommendations will change, however, because they've already
données probantes
received
importantes de
the
CCNI et
important
ils sont en train déjà d'ajuster.
analysis
Je
of the
pense qu'en fin de
data
compte, pour
by
AstraZeneca, je pense
NACI
que
and
tout le
adjusted
monde est d'accord, c'est un
eligibility
vaccin
guidelines.
efficace et
Look,
sûr.
this is
En effet,
an effective and
c'est
safe
un vaccin
vaccine.
homologué par Santé
It
Canada.
has been
Et
approved
c'est
by
très
Health
important
Canada.
maintenant avec la
And
troisième
it's very
vague dans
important
plusieurs
during this
provinces
third wave
d'utiliser
in
tous
many
nos outils
provinces to
le plus tôt
use
possible, de
all
vacciner le plus
available
grand nombre de
tools as
Canadiens
quickly
le
as
plus
possible
rapidement
and
possible.
vaccinate
Donc,
as
je
many
pense que
Canadians as quickly as possible. So
le fait que les
I think
provinces,
the fact that
comme
provinces,
vous savez, ont
as you
déjà,
know,
comme dit, ajusté, comme dit,
have already
avec
adjusted
le groupement d'âge
the
pour
eligibility
être éligible
age
pour le vaccin AstraZeneca,
for
démontre que
AstraZeneca
c'est vraiment quelque chose d'important
is a very
et
important
on va
fact.
continuer à suivre la science et
We will
peut-être
continue to
ajuster au
follow
fur et à
the
mesure comme c'est nécessaire.
evidence and trust the science and
Justement, je crois
adjust measures as
qu'en début de
required.
semaine, vous aviez
Follow-up
répondu à une
question.
question
Yes,
concernant
I
les
think earlier
femmes
this
qui
week
étaient
you
peut-être
answered a
plus
question
touchées par
about
les
women
problèmes
that seem more
rares de
affected
caillots
by these
sanguins.
rare cases
J'aimerais
of blood
savoir
clots.
si, au fur et
I'd
à
like to
mesure
know if,
du cumul des données probantes, il est possible ou vous considérez
evidence and data
prioriser certains
accumulate,
types de vaccins en fonction du sexe. Donc, certains types de
you
vaccins
might
pour les hommes, par
consider
exemple, certains types pour les
recommending
femmes.
one vaccine over another for by gender.
OK, c'est Dr. New. Moi, peut-être
One for men,
je
one
peux
for women in
répondre
some cases.
pour
This is
préciser.
Dr. New
C'est
again.
vraiment
Answer.
un événement très
Look,
rare. Et
this
c'est sûr,
I
c'est
want
comme
to
même
clarify that
comme
this is
dit
an extremely rare
la
event.
physiologie,
Even
comment
the physiology
ça arrive avec
as to how
cet
it
événement très rare
happens,
avec les
this
comme les
extremely
caillots
rare
sanguins.
event, such as blood
C'est
clots,
différent peut-être si on a déjà
may be
comparé
different
avec des
if
autres risques
if we compare it
peut-être
to
pour les
other
femmes
risks.
même avec
For
la
women, perhaps,
contraception. Je pense qu'on n'a
women
pas assez de
taking
données pour vraiment
contraception, for example.
tirer les conclusions qu'il y a vraiment une différence. Que, les premiers cas qui ont été signalés, je pense en effet c'est peut-être une biais parce que si
may have
on
created
a
a
commencé
certain bias because
avec la vaccination des travailleurs,
we
travailleuses de soins de
began
santé du but parce
vaccinating
que c'est
healthcare
un
workers
groupe
at the beginning
prioritaire.
because that's a
On sait
priority
que
group. We know
parmi
that
ce groupe de priorité, il y a beaucoup
among
de
that
femmes parce
priority
qu'ils
group
sont des infirmières, tout ça. Donc,
that priority
ça,
group is largely made
c'est
up of
quelque chose
women.
aussi aussi
So
souligner
that
comme
has to be
point.
taken
Donc,
into account as
jusqu'à
well.
date, avec toutes les
far,
analyses des données probantes,
given
on n'a
all the
pas trouvé
data and
qu'il y a
evidence
vraiment une différence.
received, we have not
On peut dire
found
que
that there
c'est
is a
vraiment
real
les femmes
difference.
sont plus à risque que les hommes. Donc, je
And we
pense
really
que
cannot say that
c'est
women
pourquoi
are at
le
greater
Santé
risk than
Canada,
men, which is why
aussi
Health
tous les autres
Canada,
régulateurs
as well as all the
à
other
travers le monde,
regulatory bodies across the
ont recommandé
world,
pour
did not
tous
recommend
pour les femmes et aussi pour les hommes. C'est pas
that this
comme
vaccine only be given to men.
plus comme dire un risque augmenté pour les femmes.
It's not really an increased risk for women.
I'll just clarify that point as well in English, that there is no specific risk factors for the thrombosis, thromboembolic syndrome with low platelets. It's a very specific underlying mechanism that is driving that rare event. There is no sex or age risk factors for that condition. How provinces in deciding the program and the National Advisory Committee on Immunization comes with a recommendation according to age groups is actually based on the impact of COVID on different age groups, where you get a much more severe outcomes in the older age groups. It's not because there's an underlying risk factor that is currently evident on the thrombotic event.
Merci beaucoup. Operator, next question. Prochaine question.
Thank you. The next question is from Mia Rapson of the Canadian Press. Your line is open. Please go ahead.
Yeah, I'm just wondering, Dr. Tam, if you could give us some more information about exactly what data was provided to NACI, what study. You said it wasn't about the blood clots, but more about the variants. I'm just wondering if you could tell Canadians what specifically they were given new data on that sort of pushed this back, not just a little bit, but by several days. And also, how relevant has NACI made itself in a pandemic when maybe the model isn't set up to make decisions as quickly as we need them? Do you think that this model is actually working in a pandemic?
Well, science is always evolving and is evolving fast, so it is quite challenging, and I can guarantee that everyone from the regulator to NACI to our epidemiologists are working continuously. So you're right in that you can't just keep shifting recommendations all the time. You do have to have analysis that you can settle on for now. Obviously, if there's any significant changes, the committee will go back and have another look. So I don't have all the details. All I was told is actually about the impact of COVID-19, including the emerging variants of concerns, impact on severe outcomes. So that data has to come from the provinces and territories. And as they provided some new information, particularly and on that front, I think that's what they're looking at. And it may not change anything in terms of what they've already come down to. I'm not sure. That is still in progress. And maybe I can leave it at that. But it is challenging for everyone in terms of the policy space for public health. But we want to, I think uppermost in everybody's minds right now is that we wanted to provide the best advice because it's about safety. And therefore, Canadians need to be reassured that all of these checks and balances are in place so that they can make those decisions to get themselves vaccinated.
Thank you. And Dr. New, I understand that there was a meeting of the chief medical officers yesterday afternoon. The last time you met, or at least just discussed the AstraZeneca issue, it was decided that every province would follow the recommendation not to give it to people under 55. Now we have seen provinces sort of jump out and make different decisions. How hard is it for Canadians to understand what is happening or what they should do when the provinces aren't aligned, we don't have information from NACI, and how hard do you think this is going to be in terms of vaccine hesitancy?
Well, thank you very much. Multiple questions there. First of all, I would say that, it's never a question of everyone quote being in lockstep. As NACI has indicated, and I think I've sort of said as well, is that their recommendations that they put forward takes into account sort of a broader public health perspective compared to the regulator, which looks at a product on a one-by-one basis, looking at the overall sort of benefits versus the risks. So with respect to NACI, that broader public health perspective takes into account epidemiology, looking at other vaccines available, and so on and so forth. So taking that now a step further, as you mentioned, with the provinces and territories, at a certain point in time, based on their understanding, their knowledge of the epidemiology and their context, what they're doing with their vaccine programs, they more or less, I think, had a similar thinking and approach with respect to, I think you mentioned the pause for those individuals under age 55. Now what's happened, as we've alluded to several times, there was another meeting teleconference that was held on the weekend. And as the province and territories looked at, sort of within their own jurisdictions, looked at their epidemiology, looked at the factors at play, they obviously, as always, the same principle, adjusted their programs to make sort of the best sort of a sense on their context. And therefore, you are seeing maybe a variation. Certainly, I think the 6 provinces Atlantic, to varying degrees, their epidemiology, I think, in terms of case counts, serious illness, hospitalization, deaths, is different compared to, let's say, the territories up north in the Atlantic region as well. And therefore, that's why you're seeing, I think, adjustments made sort of to get out the vaccines in the best possible way based on the epidemiology. So I think, for example, Quebec, I understand they have a different age cutoff, but I certainly respect the fact that based on their epidemiology, based on their analysis of the factors, this is what makes sense for sort of the Quebec context. And then you can see in Ontario, they've made other adjustments where there's also, besides sort of the age, I think it's 40 plus, that's eligible for AstraZeneca. They're also looking at targeting, I think, maybe putting vaccines or having vaccines available for administration in so-called hot zones and so on. So you can see that the provinces and territories are doing what they believe based on the evidence and the science is really sort of best serving for their context. And I think Canadians hopefully can understand and get that it's hard to have a one-size-fits-all approach. NACI puts out a broad recommendation, but I think it's more of I would call it a framework. It gives us certain parameters and certain factors to consider that obviously the provinces and territories then take to heart and then apply obviously their own lens and their own context before adjusting their programs as necessary and appropriate for their local situation. Thanks.
Thank you, Doctor. Operator, next question. Prochaine question.
Merci. The next question is from Tonda McCharles of the Toronto Star. Please go ahead.
Hi, thanks. I'll be honest, I don't really understand the explanation and the tie-in if NACI was getting information on the severe impact of COVID and variants, what that necessarily has to do with their expected recommendation as to the risk of thrombosis with the vaccines, and I understood that they were going to be weighing in on that. So maybe, perhaps you can take another run at clarifying exactly why they couldn't give the recommendation clearly on the risk of the the risk of the thrombotic events associated with the vaccines. And my question around that has to do with apparently there's been an analysis that all of the vaccines, both the mRNA vaccines and the viral vector vaccines, all carry this very rare risk. So I'm wondering if Health Canada is thinking of putting a warning similar to the one that you initially put out on AstraZeneca for all the vaccines.
So sorry, I might have missed the last bit. Just to really clarify, you brought up a very, very good point, which is the risk of the thrombotic event doesn't change. So that is not, it has not changed. It has not changed in the analysis. It is a rare event that occurs 1 in 250,000 to 1 in 100,000, I think is what broadly everyone has been using. Of course, the data could evolve, but that hasn't changed. What changes is what is happening with COVID-19 in your area. That balances the risk and benefits, because the vaccine is going to be a very effective tool in reducing severe illness and deaths for sure. And so the benefits of the vaccine absolutely will outweigh the risk of the clotting disorder, particularly in areas of high transmission and high impact. So I'm not sure if that's clear enough, Tonda. Do you want me to?
That helps. Yes, thanks.
In your risk,
yep, thank you.
Your risk benefit analysis, yeah. So could you repeat your last part? Sorry about that.
Yeah. So given that there's some suggestion that all the vaccines, all 4, carry this rare risk, have we changed the warnings on all of them?
So I think that there's thrombotic phenomenon that may be different, that needs to still be unpacked scientifically. But one other vaccine of interest to Canadians where changes is sort of expected is the Janssen vaccine. Janssen is a viral vector vaccine, very similar to that of AstraZeneca. So that also is a vaccine that Canada expects to be deploying. So Health Canada is aware of the EMA announced label updates that reflect reports of the blood clots with low platelets related to the J&J Janssen vaccine. So they're already reviewing that information and looking at that in our Canadian context. Similar process as they did with the AstraZeneca vaccine, and they'll be working with manufacturers, FDA, EMA, and other international regulators. So then they will take the action if necessary before that vaccine is made available to Canadians. That vaccine hasn't rolled out as yet. And the regulators at this time around the world have determined that for that vaccine overall, the benefits outweigh the risks. NACI will make recommendations on the Janssen vaccine, and it will take that information into account because that statement hasn't been drafted or finalized yet. So that's good because now they can take into account any new information on the blood clots or low platelets associated with that vaccine. And of course, we will be reviewing any information pertaining to any vaccines, but the Janssen vaccine is of the most interest at this point.
Thanks. And can I just ask quickly? There's a number of doctors who feel that either Canada has already approved I think at least one monoclonal antibody treatment, and yet there are others that are on the regulatory pipeline. And there are a number who feel that that would be really effective right now, especially in places where the hospital systems are really under pressure, and it could take some of the people who are ending up in hospital out of the hospital scene and free up a little bit of capacity. Can you talk to us about that? What is your sense of whether these monoclonal antibody treatments either are available to them and not being used, and if they're not being used, why not?
Yes, I will try and answer that question, and maybe you can follow up with our media relations to get any more details because the treatment side is something that maybe you need to get more information from others and perhaps from the regulator. So we do know that there are these monoclonal antibody treatments available and other treatments as well. So you've provided a very important question, which is that, of course, we've been talking about vaccines, we've been talking about testing, diagnostics. Well, treatment is another area that there's been a lot of work in, and people are pursuing different kinds of treatments. But the most important one, actually, I really feel that changed a lot of the clinical practice is dexamethasone, the steroid that is commonly available to treat patients, was found to actually have a significant benefit, and it's become part of the routine management of patients in the ICU and in hospitals based on clinical judgment, basically. So what is available, I do know, is that tocilizumab is one medication, and it helps like these antibodies to reduce inflammation, some of the significant inflammatory responses as well. And so medication has been purchased and made available to provinces and territories. and not all of them are using this medication to the same extent. And so, as I understand it, some of that supply has been shifted to Ontario from a reallocation from other provinces and territories. So that is an example of how that is happening right now.
Thank you, Dr. Tam. We have time for one last question. Dernière question, opérateur.
Merci, thank you. And our last question is from Crystal Og of Global News. Please go ahead.
Hi, Dr. Tam. Thank you for taking my question. We're specifically looking at Ontario here. The ICU numbers are raising and hospitals have transferred hundreds of patients. Is this something that comes up on your calls with provincial counterparts? And are these conversations about transferring as far away as other provincial ICUs?
It's a subject of intense conversation, I think, both at a political decision-maker level and at the operational level. So with the operations center at the Public Health Agency, as well as public safety and many federal departments, in terms of what offer of support we can provide to Ontario. That is on the healthcare side, so I'm less involved in that. But I know that we're looking at supplies from the NES, for the National Emergency Strategic Stockpile, that helps ICU patients, whether they be ECMO machines, oxygen concentrators, oxygen supply equipment, and any of the other kind of equipment they need. But having said that, mobile health units and other measures. What has been requested, I believe, also support for health workers. So it's not the equipment that is necessarily the rate limiting step. It's that you need teams of people experienced to operate these different types of equipment needed to support someone who's very sick. So I know that discussion is extremely live, and we do have underlying protocols and policies that support mutual aid between provinces and territories. And absolutely that is a very live part of the discussion with Ontario right now.
Thank you. And as a follow-up, the European Union has turned down 300 million doses of AstraZeneca and Johnson & Johnson. What's your reaction to that decision, and does Canada intend to try and scoop up those doses for ourselves?
I missed the very beginning of your question. Who was giving up?
Oh, sorry. The European Union has turned down about 300 million doses of AstraZeneca and Johnson & Johnson. So my question to you is, what's your reaction to that decision, and does Canada intend to try and scoop up those doses?
So I haven't heard of that. Thank you for that piece of information. I'm not intimately linked to the supply, but all I do know is that every stop is being paused. Ms. Annan would have spoken about this, and I know she's on the phone and other teams on the phone with European countries, any countries that may have supply. So I'm sure that that is very much part of their strategy, but I don't have any details. Thank you.
Thank you, Dr. Tam. That will conclude today's media update. C'est ce qui met fin à la conférence de presse pour aujourd'hui. Bonne journée.